You okay?
Welcome back, everyone, to our second episode of Wake Up Pancreas. I'm Danny.
And I'm Alex.
And today, what are we going to talk about?
So we're going to talk about a 3-hour appointment over at Children's Hospital, right? So it should be interesting. By the way, she thinks that all I'm going to say is I was there, and that's about it, and I don't remember a thing. But I do remember a couple of things. I would say in those 3 hours, it was a lot of disbelief. I just couldn't believe that a little girl had type 1 diabetes. And then the only thing that actually helped me out was seeing that a doctor that showed up there that was treating Marcel had type 1 diabetes. And she showed up her devices. And that actually helped me out throughout the entire process of getting me started.
You remember last time we talked about how we found out that Marcel was a type 1 diabetic. So this time we're going to discuss the 3-hour appointment that we mentioned at the end of episode 1, kind of see how it went. So Alex, can you tell us?
Yes, so we're going to go straight into the appointment, a 3-hour appointment, right? And I was telling Danny that what helped me out through the entire experience of the hospital journey with my little girl, or our little girl, I should say, is the fact that the doctor was a type 1 diabetic. It almost gave her a skin in the game, I would say. It made it legit that Marcel, our daughter, wasn't alone, especially for a type 1 diabetic.
I think, so that was Jen, our first provider.
Okay.
And the one thing that was meaningful to me, and I know I said the provider in the ER said something similar as she's so lucky, was her looking at us and again telling us she has no idea how lucky she is to have you two for parents. And at that time, I think that's what I needed to hear, that I was doing something right. And it was a long appointment. So
super long.
Pretty much how the appointment went is that we met with the entire provider team. So they squeezed us in. I guess they probably leave some openings every morning for new patients.
Okay.
And who did we meet with? So we met with the nurse educator, and they actually had us bring Marcel's breakfast with us and count the carbs so that we practice counting carbs in front of her.
So it definitely was an introduction to carbs. And if anybody out there understand what carbs is, it's basically that little tag at the back of everything you eat that says carbs.
Or carbohydrates.
Yes.
And you want to look at the grams, not the percentage. The grams is what you're counting.
Yes.
So with, she had us count up all the carbs, talk to us about, nope, that wasn't her. Sorry. So many providers that we also had a nutritionist come in, and she talked to us about how fats affect carbs, and carbs spike your blood sugar within like 15, 20 minutes, but then fats usually take like 2 hours. So it's good to kind of do a combination. That's what I remember from her.
By the way, we just found out that she's a type 1 diabetic, and they just put us in this appointment, and we're trying to figure this entire thing out all in the 3 hours that we were there. And I remember them giving us an entire packet of diabetes kit, needles, and everything, and then there you go home.
Absolutely. One thing I like to laugh about is that, I laugh about it now. As a nurse, so disclaimer, nothing here, medical advice, let's throw that out there. As a nurse, I would always pride myself and say, I'm amazing at diabetes education. I got this, watch. Oh, that person's going to be a star when they go home. But then as I sat through this 3-hour appointment, I was like, man, I'm a shitty nurse. I was like, I left them with just barely knowing how to stick their finger. Yeah. That was a life change, and I thought I was so good. What the heck? But it opened my eyes, I would say, to seeing what people truly need to know to be successful and a huge life impact.
It is quite a difference when you're on the other side, I guess, right?
Oh, so much. Remember one thing Jen said to us was that never restrict carbs on a type 1 diabetic. Do you remember what she said?
What was that?
That she can eat, so Marcel can eat carbs. We're not restricting them at all. Just her pancreas is on the outside.
That's right.
So we give her insulin for her pancreas.
Yeah, we are the pancreas from now on.
Hence the Wake Up Pancreas
Yes,
name
Wake
for
Up
the show.
Pancreas.
Because the pancreas just doesn't want to do its job.
Oh, man.
And I think we've done a really good job over the last 2 years of trying to live that motto out
Yes.
of not try to control everything Marcel eats, but more let her live a happy childhood knowing that her pancreas is just on the outside of her body.
What would you say was the hardest part of that 1 week? Remember that? That 1 week trying to figure everything out, from the needles to sticking, that trying to explain to her this is every day from now on. This is normal.
Oh man. The first week was hard. And again, I thought I knew so much, but it was like my brain decided it didn't want to work.
I shut off completely. I was going autopilot pretty much.
I had to call one of my friends who was in school with me at the time for her APRN, Advanced Practice Registered Nurse, as well. And I was like, Hannah, I was like, I don't know what to do. Her sugar's in the 400s. What do I do? She's like, Mama, you got this. And like, she'd have to give me these pep talks. I'm like, I'm on my way to Walmart. I got to get ketone strips. Ketone strips weren't given to us. And I was just a mess because I could not think straight. And I do remember as we're sitting here talking that Marcel's sugar was in like the 400s, 500s the first week. And if you're familiar with diabetes at all, fasting, so without food in your body, blood sugar should be between about 80 to 100. And then when you eat, you spike a little bit, but you don't go to 500. And she just was not coming down. And in our minds, we're like, she's just a diabetic. This is normal. And, which is probably good. Ignorance is bliss. Because I remember her doctor calling us and saying, I'm really concerned about her. Here's my personal cell phone number to call me if her numbers don't come down. And she took our call after hours because she was scared Marcel was going to go into DKA, so diabetic ketoacidosis. So what happens when your sugar's too high. She never did, knock on wood. We are very blessed with that. But the first week was scary. And I know there was a moment when we were putting Marcel to sleep one night. And she looked up at me and she was like, Mom, just one more and then we're done, right?
Oh, yes.
And I was just like, the heartbreak, like, how do I tell this
is forever. This
is
is life.
little baby that, no, this is life now, you know? It's definitely one of those hard conversations that
We still have.
we still have to have, because once in a while she'll still say something when she's frustrated with it. So it wasn't easy, and I would say she was definitely terrified at first, because she started doing well, I would say, with the finger sticks. So that she handled, but it was the insulin injections.
No, she did not like those.
She
at all.
would run from us.
Yes.
And I'm sure it was terrifying to her.
Of course
it was terrifying to me that I'm running after my daughter with the needle, like, you need this, you can't eat. Like, if we could see it on camera now, we'd be like, oh no, what were we doing?
What is wrong with you people?
So, but one of the things that we tried, do you remember, she was having such a hard time, so I called the provider, and they had like this port.
Yes, I remember the port, the ones that you put once and you put the needle through it.
Yeah.
Yes.
So it was this port, so you would like put it on. It had a patch, almost like an insulin pod, if anyone's familiar with that, or the Dexcom. It had a sticker around it, and you'd push the button, and the needle would go in and come out, and it would leave a catheter in place. Yes. And it could sit there for 3 days, but instead of the needle going through her skin, it would go through I think it was called a Mediport, but it would just go through the port, so she wouldn't feel it. So that was better for us, but I think we noticed that her sugars weren't coming down.
No, they were getting kinked every time, because she was so active. She moved so much, and she ran around like a crazy person all the time.
I think she was also really small, so there wasn't enough adipose tissue, so fat tissue.
There wasn't even enough room in her arm to put that giant thing on. She's tiny. She was tiny, and these things were about the size of what you say. 2 quarters,
probably about like a 50-cent piece is like the size of it. And at the time, so we started mentioning in the first episode that weight loss, well, Marcel wasn't losing weight is what I said, but it's because she was losing weight as fast as she was gaining it. Yes. And she had a hard time gaining weight for a while. We just didn't put that together at first. She was only 23 pounds when she was diagnosed, about to be 3 years old, and was 23 pounds. So she barely had any adipose tissue. It was hard to get the injections in. But so the Metaport failed. And I wouldn't say it was the device. It was probably the fact that our daughter is just so small, so active. Yes, so we had to go back to injections.
I remember that. Talking about that stuff, it goes back straight to the education part at the hospital. And I remember she was talking about the mythical 100. And you'll hear that, so you got to keep your sugar at 100, almost constant, right? And I'm thinking, okay, we could do that. We could keep it at 100. Easy, done. I could keep it at 100. And then I remember asking the question, so how hard is it to keep it at 100? And I think the lady just kind of looked at me for quite a while, and she just continued with her lecture about
she just ignored you?
Yeah, I think so. I think I just got ignored completely. And I know why now. It's impossible. It's almost, she's just surfing, basically.
Yeah. I mean, she eats, it goes up, then she drops, and she's all over. But going back to that, I would say first week, moving more towards the month, though. So we only had to do injections for the first month, and then luckily our insurance was able to move her to a pump. I know some people aren't able to move that fast, but they got us in for a pump within the first month and the Omnipod, and ever since, I mean, we've been doing so good that if we ever have to use the backup insulin, she freaks out because she does not remember ever having to use the insulin pens.
Correct. It's a lot easier now with those. It's still challenging from time to time, especially because they're sticking. You got to take them off. We do use, what do we use again?
It's this adhesive, like this anti-adhesive stuff that we bought on Amazon to get the stickies off because the adhesive was so painful coming off of her and it would leave rashes. So we had to find innovative ways to try and get it off. And but she's doing pretty great now. I mean, it's been 2 years, but I would hope she's doing good.
It's been 2 years. Okay.
All right. Well, that wraps it up for episode 2 of Wake Up Pancreas.
Wake Up Pancreas.
Come back for episode 3 next week.
All right. Have a good one. Bye.